It may be a breakthrough in diagnosing Parkinson's disease, a new scanning technique that can detect the earliest stages of the illness in the brain before the first symptoms start to show. The cause of the disease is still unknown, but according to the National Institutes of Health, about 60,000 Americans are diagnosed with it each and every year. The average patient is about 60 years old, and the risk rises significantly with age. However, about 5 to 10% of people with Parkinson's have early onset, and that begins before the age of 50. Dr. Devi assistant professor at New York University School of Medicine, joins us now this morning to shed some light on that for us. Doctor, thank you so much for being with us.
Oh, it's great to be here.
So how significant is this breakthrough?
Well, it's a huge breakthrough because being able to diagnose people early actually means we can study more about the disease. You know, what actually happens, how does it evolve, what can be done to stop it. But it is a mixed bag because for the people who are going to be diagnosed early, we don't have a cure yet. You know, there is no cure for Parkinson's disease. So it's not that being diagnosed early actually means that they'll have a change in the course of their outcome.
So let's talk about this new scanning technique. It could predict the onset of Parkinson's in 11 out of 13 patients. Let's pull up this graphic, or that's 85% accuracy. How is this new technique different from a regular MRI?
So it's called a functional MRI, so it's a little bit different. MRIs usually are just pictures that look at your brain. So in this case, you're looking at where the activity is going on in your brain. So for Parkinson's, some of the problems are actually related to movement. There's two different problems. First, you know, the movements that you want to make, you're having trouble making them. So that's why people with Parkinson's move relatively slowly. They can have trouble writing. They can actually get kind of a frozen, rigid expression, like a facial expression. So they have trouble making the movements they want. And then the other problem is that they can't stop movements that they don't want to make. So they can have a tremor. They can have other problems. So with this type of MRI, you actually look at that part of the brain and you can see that there are some problems early on.
So should getting a scan be part of basic preventative care, and if so, at what age?
No, I don't think it should be preventative care because we don't have a treatment. So if there was something that we could do that could actually prevent the disease from happening or progressing, then it would be ideal. So things like colonoscopy, something where you can actually intervene, those are great for preventative measures. But for Parkinson's, the problem is that, you know, because we don't have a treatment, it's really an ethical question. So for people who actually, you know, they are genetically predisposed or they want to do something to help other people with Parkinson's, they want to try to get experimental treatments, then it's great. They can volunteer and find out about this and maybe have a change. But it's not perfect because some people might feel like if they get diagnosed early and then they don't have a treatment, I mean, doesn't that affect the rest of their life? I mean, you have to carry that weight on your shoulders too.
Well, you touched upon family history. So what about genetic testing or chromosome testing? What can you do in terms of that?
So there's not one specific gene that's involved in Parkinson's. It's related to mutations. So sometimes if people are related to things like Agent Orange, for example, you know, then they can be more at risk for having those mutations.
Sure.
There are some familial cases of Parkinson's where there is a genetic component. That's still a minority of the cases. So, you know, if somebody has a strong familial component, then you can look at genetic tests or try to monitor that person more closely, but it's not the normal way of doing things. It's not so genetically correlated.
So are we any closer to discovering a cure? I mean, you mentioned there isn't one.
Yeah, well, we're closer. So this is a breakthrough. I mean, I did say there are some ethical conflicts, but the thing is, if a person gets diagnosed early, then you can watch their MRIs, you can watch their brain, you can try different treatments, you can develop new drugs and test it on people to see if you can slow down the progression of Parkinson's. So in terms of research, it's a huge advance. In terms of the people who are actually already suffering from Parkinson's, you know, we're getting closer to a cure, but we're not there yet.
Not quite there. All right. Dr. Devi, assistant professor at New York University School of Medicine. Thanks so much for joining us.
Thanks for having me.
We appreciate it.